So, I think that one of the problems we've had in healthcare is that most health systems have felt they need to be everything to everyone. And I think that has been a cause of the problem. It's, again, some of your rural hospitals that have closed, for example. So I do think we need to rethink how we regionalize and rationalize care. And that's going to be a journey because everybody has their own idea of what that should look like. But in real value-based care, you should be doing the things that you do really well with terrific outcomes in high volume at low cost. And we need to think about, are there services that should be regionalized and centralized? So where we had rural hospitals, maybe we need freestanding EDs and outpatient and ambulatory facilities, but we don't need an inpatient facility. But we then need to have a hub and spoke system that can get those patients who need care.
You got to be able to do thrombolysis.
Exactly.
Because now we have a therapy, which we didn't have 2 decades ago, but now we have therapeutics which actually are life and death defining.
And the other piece is we need to get, for example, in thrombolytic, we need to get that information and that expertise out to the people at the point of care as well so that they can provide that care.
Yeah, I agree. I think it gets back to, being able to offer this breadth of services. A good example, when you're talking about rural closures and things like that, a good example is Intermountain created a virtual hospital. So I think it's going to be innovations like that that help get over this hump so that we don't have gaps in care.
So I think Intermountain's a great example that you brought up. If we look at what we'd like to see as the IDN movement continues to expand, probably are certain areas like that where you could look at best in class. So here are a few of them. I'm curious if anybody's aware of kind of offering a best in class. So cross continuum coordination of care. Are you aware of an IDN? Have you had an experience where you would argue that, somebody's got that down? One that's come up before, in my work has been Geisinger.
Yes.
And you wonder about often when you have these examples, are they one-off situations? Are they so unique and so in some fashion? And Geisinger, because of its just geography, that it can do something like that, but it wouldn't be possible, let's say, in most places? Or is it just a great model and it needs to be replicated?
I think, they're also, again, they are an integrated system that has a payer, and they do cover the entire continuum. All their docs are employed. They're like a Cleveland Clinic, Mayo Clinic model. They just happen to be in a smaller metropolitan area. And I think that also speaks to their leadership. David Feinberg is a very innovative guy. He's talking about he's getting them to deal with things like social determinants of health and food deserts and all those kind of things. So I think they're just very forward thinking. I'd like to think it's replicable because it's a great model. I don't know.
Yeah, I agree with that. That I do think it's replicable, and a lot of it has to do. They have really good systems, and that is a lot of times the biggest barrier to being able to deliver that.
So that was going to be my second question of best in class is where is there really great IT systems and interoperability across the care continuum that often is critical to having the care continuum be successful. And I don't know if there are other examples of that, but that would be one. Population health management seems to be one that would come up on the list of what you'd want to see accomplished. And I'm listing them because I'm not sure that we have these rare examples, but we don't seem to have persistent models. So if we think back, though, maybe the one system that was being touted to have been the model was Kaiser. And so there's been a lot written about, the Kaiserification of the U.S. healthcare system, which didn't materialize. And it does, wonder if such high praise, is duly earned. And it's not coming up as we're having this conversation about best in class. And yet it's been kind of unique. And I'm curious about your thoughts about the Kaiser system.
So I think you have to think of which Kaiser you're talking about. If you're talking Kaiser in California, there's a lot that's good about that and worthy of emulating. If you're talking about Kaiser in the eastern United States, unfortunately, they haven't been able to replicate their model very well because they don't have the degree of integration.
And they don't, because they don't have enough membership to have comprehensive resources, and they have to outsource stuff, and that leads to a deterioration of the ability to execute the management. It's interesting because we talk about oncology, and I must say, I've never heard anybody say that Kaiser had a particularly good oncology delivery program. Please correct me if I'm wrong, but I haven't heard it.
No.
I haven't heard anything good or bad.
No,
No,
exactly
but
right.
you do. You hear about population management, preventive health. You hear about, you hear about those things. You don't hear often about specialty service. They're not.
That's exactly right. So that's what I was thinking, right? So, all right, primary care, excellent. Specialty care, help me out here.
I got
I'm the
nothing.
moderator. I
got
can't
nothing.
say.
No, I'm serious. I think the question of whether these kind of models, as they have evolved now into this risk model, look more and more like regular health insurance, right? It's really good to have people who don't have a lot of medical illnesses because coordinating their care isn't that complicated, it don't cost any money, and we can give them everything they need. And it is interesting. And I must say, and I'm an oncologist, so I hate hospitals. It's very hard for me to see hospitals really get to where you want them to go in this discussion. I just don't see. I have a hard time believing it.
Yeah, so where I struggle and why I wanted to bring it up is that because there are these examples like Geisinger, and it's everything you read about it seems to be doing all the things that kind of what we envision to be the next better place, the next better platform of healthcare, and it's not just what you read from kind of the pundits, but also what you hear from the communities that it's serving, and then there's a question, it's replicable, but it's not replicated.
Right. Well, and I think a lot of that, again, has to do with systems. I mean, a lot of these hospitals and these systems are really struggling just to get up to date and get up to date with Medicare mandates. I mean, it's really difficult. And so I think that until that happens, you're not going to see this being replicable.
Well,